I've met many different people over the years, but there are two personality types that have stood out for me. And one is this sort of let's try this and see what happens mentality. There's a can-do attitude. Rather than study something for years before trying it, they dive in and learn on the job. And if it goes well, great. And if it goes wrong, well, so be it. At least we tried. And it's not so much a who do I ask mentality as a what's going to stop me. And such types end up as entrepreneurs, explorers, inventors, sometimes artists. And then there is a much more cautious, risk-averse type, and they'll often focus on why you can't do something rather than why you can. They seek permission, not forgiveness. And these types often end up in structured, safe careers with clear parameters. Civil servants, solicitors, accountants, doctors, that kind of thing. And they tend to be employees rather than self-employed. And they often do well in big company environments where it doesn't pay to rock the boat. And I guess in a successfully functioning group or a society, you want to have a healthy balance of the two types. One to push boundaries and the other to rein them in. Now, what concerns me with COVID is that power and decision-making has somehow fallen into the hands of this risk-averse health and safety mindset that proliferates public health, that we dare not do anything. And national destiny is determined by people whose first instinct is to find reasons why you can't do something, not why you can. And this is so even though COVID is not yet fully understood and the efficacy of certain measures, masks, lockdown, the data analytics disputed. And one set of data, COVID deaths and infections, is scrutinised, and the other immeasurable data set, which is the cost of locking down, goes ignored. And this is pure Bastiat and his broken window parable. Not just the cost to businesses and the economy and all those whose livelihoods have been ruined, but the cost of having lives, relationships, social contact, free movement, experiences, to kids, for example, of having their key school or university years taken from them. Now, I'm not an epidemiologist, I can't even say the word, nor am I part of the new amateur expert class, but I can still see that there are many who have either had COVID or are unharmed by it, and they're paying a price they should not have to pay. Collectivism is supposed to be for the greater good, and it's not even clear that this safety-first approach is even working to stop the spread of the disease. At a certain point, a let's do it approach has to take over for the sake of national sanity. Otherwise, the medicine is going to be more harmful than the disease itself, if it isn't already. Thanks very much for watching. Please subscribe to my channel, and I'll see you soon.